Assalamu alaikum and very good afternoon to all of you. This is Dr. Asia once again with you from our official Facebook, YouTube and LinkedIn channels. Today's topic is all about neurosurgery. So let me make it this way. Neurosurgery is the medical specialty concerned with the diagnosis and treatment of disorder which affect any portion of the nervous system, including the brain, spinal cord, CVS system, cranium, and spinal cord. I know you got it really, you didn't get it. Let me make it simple for you. This webinar is to simplify things, to simplify neurosurgery. So let me make this little easier for you. If you or your loved ones' concern is headache, recurrent headaches, recurrent dizziness, neck pain, lower back pain, upper back pain, or radiating pain, trust me, this is the right timely webinar to attend. At Prime, we have neurosurgeons who are highly skilled, polite, and informative, so you can understand the issue and the solution. With this, I would like to welcome my first webinar, or my first speaker on this webinar, Dr. Mostafa Raafat.
Hello, Dr. Asia. Thank you
Good
for
afternoon,
the
doctor. How are you doing?
Yes, I'm fine, totally fine, alhamdulillah.
Dr. Mustafa has obtained his PhD in neurosurgery from Cairo University with more than 9 years of experience in the field of neurosurgery, from managing brain tumors, head injuries, spine injuries. He has also comprehensive experience in degenerative spine surgeries. And also, I should not forget this thing, because this should be one very important thing to talk about, is congenital anomalies, which particularly means any abnormalities of body structure or function present at birth. Welcome, Dr. Mustafa.
Yes, welcome.
Now I would like to request my second speaker. I welcome Dr. Srinivas. Dr. Srinivas Janga. Hello, doctor. It's always good to talk to both of you because it's very convenient to reach to you. Okay. Dr. Srinivasan has earned his MCH neurosurgery from Nizam's Institute of Medical Science, Hyderabad, India. Very prestigious institute. Trained in microneurosurgery, specially trained in endoscopic spine surgeries in India and South Korea. Technology edge, what we say, is keyhole, stitchless endoscopic surgeries, laser-assisted lumbar disc surgeries, stroke as well. Like, for example, stroke surgeries for a brain hemorrhage and brain cost. So these names probably looks very difficult to understand. We will be really simplifying for you. We know that biggest concern for anybody is that we don't understand the advanced techniques in neurosurgery, and we could see also that is delaying the outcome of the treatment. So here I am with Dr. Mustafa with the first question, doctor. Doctor, neurosurgery is definitely a vast topic. We cannot say no to that. And let me start with something really, sudden. For example, mishaps happen, traumatic brain injury or trauma patients. Are we really equipped with that? I want to know from you.
Yeah, in neurosurgery, too many cases of traumatic brain injury and spine injuries we see in the emergency and then in everyday practice. The good news about these cases that 25% or 30% of cases are concussion, and among concussion cases, only
Doctor, I would like to stop you here. Is my audience will not understand concussion, so we'll have to further simplify it to make it
concussion is when you got head trauma, you feel dizziness or alteration of consciousness, post-traumatic headache, post-traumatic dizziness, vomiting once or twice. This means you got concussion, and the concussion is 3 grades, and but the mild grade occurs in 30% of head trauma, head trauma patients, and only 10% of cases will get post-concussion syndrome, like headache for 1 month or something. But other cases are brain hemorrhage cases, which are very little, but when we manage these cases in the proper time with the appropriate management, we get the best results. Yeah.
For example, doctor, there is an emergency where the head trauma has like happened, and multiple spine injuries. The patient is coming to the emergency. What will be the next step, and are we really equipped for that?
Yeah, we already have this case like 1 month ago with severe traumatic cervical spine injury, a very challenging case like C5 spine fracture, which was compressing the spinal cord, and the patient was about to get totally paralyzed. But the initial management of this case with proper application of the neck collar and steroids given at the proper time, we made our MRI, diagnosed the case, and we bought our plan. Surgery was done within few hours, and the patient returned back to life like normal through a small opening, microscopic surgery, very advanced surgery, and the patient returned back to work already.
We talk a lot about microscopic surgeries. What does this really mean, microscopic? Because we will be using this word quite often. So what does this really mean? Yeah, just for our audience to know.
Every day in neurosurgery, we get new surgical techniques because patients' expectations are high. And when patient expectations are high, our expectations should be higher. We should take the patient to perfect outcome. When they want good outcome, we should pursue a perfect outcome. So in microscopic surgery, we try to stick to the guidelines, stick to management plan, stick to our strategy, but we do our surgery through a very small opening, minimizing collateral tissue damage, and doing our job through our keyhole surgery. That's what we do in microscopic.
So absolutely, for our viewers to know that we do have highly skilled neurosurgeons and the expertise with us. With this, I'm going to now ask the second round of question with Dr. Srinivas. In our current life, I believe this question is for audience also. How many are affected with back pain? I'm sure many numbers, but I still am expecting some answers in the comment box from the viewers who are watching us. What is your opinion? Are you really affected with back pain? And what do you say? Just write in the comment box. In the meantime, Dr. Srinivas, most people experience back pain at some point during their life. Often it is mild and resolves quickly on its own. From the basics, I would like to know for my audience, what is the natural history of low back pain?
Yeah, thank you, Asif. Regarding the back pain we talk about, as the evolution advanced, our spine has become erect. So in the day-to-day activities, everybody is prone for the back pain or neck pain at least once in their lifetime. Without that, nobody will pass through. Okay. So the back pain do happen because of even though we do all the routine normal activities, sometimes we do suffer. The back consists of a lot of structures over there like muscles, ligaments, joints, nerves, bones, a lot of things are there. So any of them will get some stress and we feel the back pain. So the reasons for the back pain are our day-to-day activities. Most of the times, what we do, how we sit, how we look forward, and how we put the spine erect and do all the day-to-day activities. And the weights we lift. Like suppose we are trying to lift something above our neck and we are stressing something, then we may get some catch in the neck. So unaccustomed work we should never try to do. And regarding the back, if we are sitting for the long posture, long time, and we are not supposed to do anything for the long duration, that will put some stress on the spine. So everybody is prone for the back pain, and we should be aware of this thing. That's why this webinar is going to happen, and you people will become aware about the situation so that you can prevent to get this kind of backaches and all.
Doctor, immediate question: how frequently now patients, like in last 2 years, we know that we are working from home. Most of the sector people are working from, and they continue are working from home. Schools are also like most of the things are happening. Schools for them also work from home. How badly people are increased in back pains? Like, what do you see in routine OPD? Is there really something a concern? And overall, what is the current statistics about low back pain in UAE, if we have the numbers, and around the world?
Yeah. So, speaking about the current scenario, last 2 years, there is a significant rise in the back pain patients. Actually, these 2 years, we were busy in seeing these kind of patients because there is some shift in the lifestyle activities. So, some are sitting at home and they become overweight, they're not doing exercises, a lot of things. And working from home, sitting for the long duration of time, there are no breaks in between. Definitely it was a very stressful life. Now we are coming out of the situation, thank to the god. So incidence wise, if we see, if we compare, definitely I don't have the statistics, but definitely the numbers have risen, and people suffered from these issues. Particularly when you go to the gym, suppose you are sitting at home for a long duration, then you think that okay, now I have to go to gym, and they start doing aggressively. They lift weights which are not accustomed to lift them, and they try to lift more weights, and suddenly some catch will happen in the back, and that will take the toll. So whenever you are starting any physical activity, it should be very gradual, progressive manner under the professional guidance you should take. Okay, so that's the perspective present today scenario. Definitely, the back pain incidences have risen, and we should be aware of this so that we can prevent the back pain.
So, doctor, any special advice for the parents, right?
Yes,
Since we are
yes.
talking about back pain.
I will talk about that. Particularly for the children, back pain and neck pain, sitting in front of the laptop, and they don't get up while they are attending the classes or not. Still, the parents, even I have observed my child also, they are taking care of them very nicely. After every 1 hour of the class, uh, they are making sure the child to get up, do some activity for 5 minutes, and again relax, and then again attend the class. They were taking care of the kids. Really, we should appreciate them because we have never seen such a situation. And
Abs-
the children, definitely the compliance is very very less. So when they are at home, parents should take care of them, how they are sitting, how much comfortable they are, and how they are attending. So we should make them aware about their posture, like sitting erect or not, and how is their neck position and all. So if we take care of these things, at least we can prevent to some extent. Of course, this is not advisable, but we have to go through it. Everybody has gone through this, but fortunately, the children has a very flexible spine, and they came out of the situation. Mainly for the adults.
Absolutely. Absolutely, Doctor. Ergonomics has a huge impact on the human body, especially as you correctly said, our spine should be in the curved position, but it is generally now getting straight. With that question, I would like to ask Dr. Mustafa a very curious question for all my patients to know, and for particularly as a general practitioner, I also want to know.
Mhm.
We generally tend to immediately seek an advice from the orthopedics, right? We cannot deny this thing. Low back pains means immediately we go to the orthopedist. We do a couple of MRIs and things like that. When is pain a really serious concern where we should either definitely go to neurosurgeon or at least take an opinion from both the specialty?
Yeah, okay. And this is a very common question. It's a very common debate. When I have back pain, should I go to orthopedician, or yeah, or I go to neurosurgeon? Okay. And the answer to this question, I think you should go to a spine surgeon. Okay.
Right.
Some neurosurgeons are specialized in spine surgery, and some orthopedic surgeons are specialized in spine surgery. So whenever you get this problem, you go to a spine surgeon. And when the pain is in back and radiating to one of your limbs with severe nerve pain, then your surgery will manage your case, because dealing with the nerves, and it's not usually this sciatica or brachialgia is due to disc disease or requiring fusion or something. Sometimes spine tumors and other conditions that only neurosurgery can manage. So collaboration between the two specialties is well established for now. But for some cases, neurosurgery will better manage.
So it also depends on the extent of the disease. For that matter, generally most of the hospitals, because our viewers are not only from UAE, they're from several parts of the world. Sometimes neurosurgery, since being it's a very specialized branch and it's like super specialized branch, sometimes we don't have neurosurgeons. That doesn't mean people will not go to the orthopedic or to the other doctors, but it's whenever you have possibility, you always try and seek second opinion. If your back pain is really a concern, if your neck pain is really a concern, if you have recurrent headaches, if something is persistent for a prolonged period and you really are not able to find out the reason, then neurosurgery can be one of the options to always help you out. So, and Doctor, I have a question from Mr. Khurshid on the screen. You can see probably Dr. Mustafa can answer to this. Tell me about diabetes patient have neurological issue and numb of hand and foot. Since we want to talk about radiculopathy, so maybe you can answer this question as well.
Yes, okay. Diabetes as diabetes and diabetic neuropathy is a very common condition that we can see every day in OBD. But in our practice, we see diabetic patients and other conditions like disc disease, cervical disc disease, carpal tunnel syndromes, which is the surgical conditions. But for diabetic neuropathy itself, it's better to be managed by neurologists.
So just for my audience to know, diabetic neuropathy, it means the neuropathy, the problem in nerves which has been affected with the diabetes or long period. We generally have kidney issues, nerve issues, eye issues. So diabetic neuropathy is one of the long-standing outcome of diabetes. Doctor, please continue.
Yes, but we have to differentiate between numbness of hand and foot due to diabetes and because of other problem in the spine. And this is the cause why you have to seek a neurosurgeon when you have numbness or tingling if your hand or feet, because we can differentiate between the issue from the spine and issue from the diabetes or diabetic neuropathy itself.
So you mean to say that anybody who has, most of the people, those who are especially on the computer, this is a very common complaint. I feel, irrespective whether the person is having diabetes or not, but if they are long standing, on computers or one kind of position they are maintaining for more than 8 hours, they generally have this, at least this wrist is affected, the numbness is in the hand, tingling sensation in the hand. So that means some nerve is getting impeded somewhere, right, doctor?
Yes, and hand numbness, it's very common symptoms that patients present with, especially numbness that awakens the patient in the night.
Yeah.
These patients are highly suspected of having carpal tunnel syndromes. Sometimes patients have carpal tunnel syndrome associated with other cervical spine problem. It's double crush or double crush syndrome. The nerve is compressed above and compressed below. So there is overlap between numbness due to diabetic neuropathy or numbness due to nerve entrapment in carpal tunnel syndrome and numbness due to cervical spine problem in hand.
Absolutely, doctor. So, doctor is I would like to interpret the whole thing in a very simple thing. What, as a patients, we need to know that if while sleeping also you feel numbness, that is really a concern and you should visit a neurosurgeon.
Yes.
And if this is continuous numbness over the arms, over the neck area, over the hands, then that means it is beyond the bone part. It is definitely affecting nerves somewhere. So neurosurgeon is the right doctor where we should go. Why we are talking so much in detail about this topic is because We are all, working throughout the day. We are mostly, our lifestyle is quite sitting, and we are generally very prone to get into these diseases. So in order to reduce, in order to prevent, in order to know what we actually need to know, we are here to discuss. So I request all the viewers to write their questions in the comment box so that we can discuss directly to our doctors. Dr. Srinivas, I think you have taken enough rest. So I'll come back to you again. Spine surgeries, very important topic, since we are experts in this, and we really want to know much about it, because spine, whenever it comes to spine surgery, a person, generally my patients think, oh no, I can't go for spine surgery because then I'll be handicapped. Touching my spine is not a cure. Touching my spine is the last option I will avail. Touching this, that is why most of the things people don't feel like, going to surgeon means surgery will be happening. So what is your thought on this? Let us start with generalized for patient. What is spine surgery? How important it is? At what point of time? What is important for all of us to know?
Yeah. If anybody asks for the heart surgery, bypass surgery, they are ready to convince immediately. Oh, now I have to undergo the bypass surgery. But that is a very, very supra major surgery. When it comes to spine, even though it is I cannot say it a minor surgery, but still people are afraid. This is all happened because I will tell you. First, I will come to the point. See, all patients won't need surgery. 95% of the times we manage with a conservative approach like medical management, physiotherapy, all the methods. And when they fail and which is not helping and the situation is demanding, then we recommend for the surgery. So regarding the spine surgery, it has evolved a lot. It is not like the olden days. Before it was like used to do a big cut and do a lot of muscle retraction, which puts the muscles on the stress and used to remove a lot of bones and ligaments. And it was a destructive surgery. I do agree. So when I was trained in 2005, that time it was like that. But as the evolution passed, so it came to the microsurgery. It shifted to the keyhole, small, 1 inch, 1.5 inch, and then put a tube and see the microscope and see. So this has reduced a lot of complications like before. Before, a lot of muscle damage used to happen, and now because things have changed and the technology has advanced, we have reduced the adjacent structure damages. And now it further leaped into the endoscope. So I have evolved from an open surgery to the micro to the endoscopy. Like that, the things do evolving, and it has become so refined that we generally discharge the patient in 1 day. If we operated any disc patient, they can go home. Actually, in India, we used to discharge on the same day. So some surgeries,
Absolutely.
8 surgeries. It has become so simple, and not only that, the complication rates have also come down because microscope we see under visualization, endoscope we see under good visualization, and we avoid the damages to the nerves, and we see everything crystal clear, and we can do whatever the things we want. So now it is there is no need to fear about the surgery. When the situation is demanding, you should not be afraid and go back. Why? Because that also I will tell. If we are afraid and we ignore that we don't do surgery, what happens? Suppose one disc prolapses. So it sometimes it will stay there and it becomes very hard. And
Doctor,
after
I'll just interrupt you here. Disc
okay,
prolapse. Can
yeah.
you please elaborate this part, because this is very commonly
Ah,
and misused word by most of our patients. That I have disc. Doctor has told me even they don't say disc prolapse. So disc is a very big word and
yeah,
mostly misinterpreted one. Sorry
yeah.
to interrupt you here.
Okay, thank you. It's fine. I will elaborate. So basically, spine has got some bones, and in between there are soft things like cushions in between the bones. So those are known as the discs, which helps in the movement of the spine, front, back, sideways. Because of that, only we will be able to move, and it is like a jelly kind of material. So any stress on the spine can lead to a break in that, and it can come out. So that we call it as a protrusion. If it comes more than prolapse, then it comes furthermore, then extrusion, a lot of terminologies are, whatever it is there, when it comes out, it will touch the nerves and cause the pain in the back or the legs. So how to deal with it? I was talking about the surgical management. So if we ignore surgery and keep pulling on this, whatever the fragment that came out, it becomes very hard and it becomes difficult to remove it. So if we ignore and postpone the surgery, it may lead to further and further complications, and it can come back again. It can lead to a devastating situation sometimes. So we should not be worried about it. You should discuss with your doctor about what is the situation, where I am standing, whether conservative or surgery. Suppose in
Doctor,
Korea,
very, very important point here. What you
yeah,
mentioned is basically that we delay surgeries. Now,
yeah,
what comes to my mind suddenly is that, we keep surgeries for old age. And how good it is for young people, because generally you young people have a denial issues that we are definitely highly educated, we are at very respected position, but this health denial is still a concern, and we keep, whether it is any other surgery also, we keep on delaying. So
yes.
how good is delay?
Yeah, definitely delaying is a bad situation. When the situation demands surgery, you have to. Whether you are young or old, if the problem is more, then and it is not going with the other means of conservative approach like medicines or physio, then you have to go for the surgical option. If we delay, then sometimes we have to do more bone. We have to remove more bone, and we have to work on more things, and it may leads to some spinal fusion. Simple disc surgery can leads to major supramajor surgery in the future. That's what I was telling you. In Korea, the conservative approach timeline is actually very short. They don't manage because the outcomes are better with a small keyhole endoscopic, and then we can stop at least the further problems which do happen if we don't do that. So when the solutions are available easily, we should opt for it. That's it.
So I would like to simplify it for people who probably are thinking about the surgical procedures. So if you are visiting a neurosurgeon, or you have already you got to know that maybe surgery is the option, doctor will definitely discuss the treatment options. But very importantly, you can work from the second day, right, doctor? So it is that simple. Even I know it's not easy to understand, but yes, after spine surgeries, the first thing what doctor will ask you is to bend. That's what I have seen most of the doctors doing, and it will really lead you to surprise that, doctor, how long the person will be on sick leave, and what is he supposed to do after the surgery? How it is going to affect his other life?
Yeah. Usually, after particularly different surgeries have different rest kind of thing. Usually, for the endoscopic disc surgery, I do recommend at least 1 week of home rest, not the bed rest. Now there is no bed rest. Patient can walk immediately on the day of surgery. After 4 to 6 hours, they can walk. And
Absolutely.
home rest for 7 to 10 days, because inside the healing should happen and it should not further recur, because we do see recurrences in some cases if we ignore, and if we do not follow proper post-operative instructions, then it can again come back. So if we are careful enough, for 7 to 10 days is adequate time for the recovery. And some people do take some more time, definitely, and we do recommend according to the situation.
So, but it is for sure that I want you to know from you recent surgeries, what I have also observed and followed up, in how long a person is able to drive back, and drive back doing regular walkings, and go back to the regular schedules.
Yeah. Usually 2 weeks is recommended after any disc surgery. After that, they can drive, and they can be lead to the normal life in a gradual manner. And walking also, they should gradually improve. They should not walk on the same day for long hours. Slowly, 5, 10, 15, 20 minutes, like that graduated manner they have to do. and that's how they do recover, and then they will
It
be back.
depends on the surgery, but mostly you are allowed to walk on the same day. That is how your recovery will also be checked. I have a question from Mr. Tausif Suleimani. Hi, doctors. Thank you for informative session. Just want to know that how often patients should go for regular checkup after microdiscectomy. I myself underwent the same procedure 4 years back. Although I am fit and fine after surgery, should I go for any follow-up?
Yeah, yes, Tausif, I can answer your question. Good that you are absolutely fine. So usually, at least an year, in every year, you need to check with some X-rays. And as you are not having any issues, that's fine. You can continue as long as you are fine. There is no problem. Now, almost 4 years now, so there should not be a concern. Usually, we follow up at least for an year time. After that, as and when required, we follow up. So for you, Tausif, no need to be followed up that aggressively, only whenever you have any pain issues or anything. But one thing, if you go and meet, it will make you to prevent further problems, and you will come to know some more things so that you can take care of your back. My suggestion is to visit him once at least.
I'm sure he will visit you only. He's your patient, probably. Okay, I'll take up question from Mr. Shrikant Lonkar. It is directly from Dr. Srinivas. Dr. Srinivas, how to get rid of back pain by doing some home exercises or any suggestion from end to change any habits like sitting and sleeping positions? Very good.
Yes,
Nice.
yeah. Yes, Srikanth. Nice to see you here. Um, See, to get rid of back pain, you need some guided exercises. Routine exercises can be fine, and if you are overweight, you have to focus on the weight reduction, and regular exercises are enough. First of all, if you do starting any exercise, first you should have stretching and then some kind of warm up, and then you should go for the exercises. And regarding the sitting and sleeping positions, sitting, first I will come to the sitting. You should sit in the upright position. Always there should be some headrest. Whenever you are sitting, always you should take the rest of your back, and the neck should be properly supported, and your elbows there should be rested, and your wrists also should be rested on a proper table. And when you are sitting, your knee should be at a right angle. It should not be elevated, or the feet should not be falling off the ground. So you should take care of proper positioning and sleeping. In the sleeping position, most of the times we recommend to sleep in the sideways, because in the sideways the intradiscal pressure is less. If you sleep in one side with proper supported mattress, like nowadays we have memory foam mattress which absolutely fits your curvature of the body, whatever is suiting you, you have to observe. The mattress which suits me may not suits you. You have to observe whether you are comfortable or not. Not only the sleeping is one thing, and driving the car also. When you are getting in, getting out, when you are sitting, how is the car, we will see a lot of things, whether this is comfortable for me, how is my vision, all these things we take care of. Similarly, the sleep also, whichever is convenient to you, whichever the body has already adapted to you, you can continue that, but the recommendation is the sideways sleeping is better.
Thank you, Dr. Srinivas. Dr. Mustafa, let us come to your special expertise on brain tumors. Because tumor is not that pleasant topic to talk about, but hiding symptoms for longer time is really a concern. So I believe most of the time headaches. How to know if the headache anybody suffer from is due to brain tumor or not?
Okay, first, to speak about headache, many patients who present to our clinics who every day complaining of headaches. Only a few number of these cases would be diagnosed as brain tumors, and the numbers are surprising. It's like 5 patients in every 10,000 headache patients. 5 patients will be diagnosed as having a brain tumor. And from these cases, brain tumor, most of the cases, it will be small tumors that may not require surgical intervention or something. In some cases, may require follow-up or gamma knife resection or something. Some other cases would require
Camera.
surgery. And the main concern in neurosurgery, in brain surgery, is how this surgery will affect the normal brain tissue. Like how in this brain, which is a very delicate creature, how can we go to resect a brain tumor without affecting the normal brain tissue? And the new technology in neurosurgery allows this to be done. How new techniques now are available in tumor resection, like awake craniotomy. In awake craniotomy, we go to resect the brain tumors while the patient is awake. Only local anesthesia for the scalp is given, and you can resect the tumor, and the patient is communicating with you. You are talking with the patient is moving his hand, and you know where exactly you are working using the navigation, where you can guide it by this navigation. You can know exactly where is the motor area, exactly where is the speech area, to avoid any collateral damage, and you resect your tumors, and the patient needs no time to recover from general anesthesia, because there is no general anesthesia, and he stays only for half a day in the ICU for just follow up, maybe 1 or 2 days in the hospital. And this is the most advanced technology in brain tumor resection.
It's an absolute pleasure to know it. I'm sure most of the people don't know about it. That brain surgeries once upon a time was a nightmare, and knowing that patient is still awake while we do the brain surgery is definitely the last thing a person can think in this time. So, God forbid this should not happen to anyone. But if anybody is affected, the latest technologies are available, and you should be aware of these things, because it's your life. You have to take a decision on that part. When we talk about the head, we also should talk about neck, and the current concern for anyone, I'm sure all of us, is the neck pain, and is one of the reason is mobile. So doctor, anything about the neck pain, we would like to hear from you.
Yeah, the numbers of neck pain, the prevalence of neck pain, it was 17% of patients seeking medical advice or surgical advice for hospital, 17% in 2016. Okay, this number jumped the double. Now it's 30% in 2021 after the COVID and everything, and the extensive use of smartphones, laptops, and everything. 30% of patients presenting with neck pain. This is a hilarious number. Okay, around 75% of these cases, the pain is only muscle spasm. As Dr. Srinivas has talked now about sitting in the upright position, sleeping with your neck supported, not elevated, at the same level of your shoulder. Now we have memory foam mattress and memory foam pillows when we can rest and using the headrest whenever we are sitting for a long time. And another point which is very, very important is neck stretches and exercise. Whenever you have strong muscles in your upper shoulders and your neck, you will not get neck pain very frequently unless you do a very vigorous movement. But in daily exercise, or in daily performance, in your work, in your typing, and anything, if you have good muscle power, you are not getting cervical spine problems very easily. Okay.
So in this case, doctor, generally it's a very natural tendency for all of us. Like if I'm not a general practitioner, but my family who are generally affected, because everybody is on mobile. Even my grandmother is on mobile. So they have a pain, they will just take any analgesics, and it will keep on going. And the day will come that every day one has to take the medicine, and then we will take the muscle relaxant. When it is really alarming to see a specialist in this case?
Okay, like I mentioned, 30% of population may get neck pain. Okay, but when this neck pain is alarming, when pain is radiating to one of or both arms, or when it's affecting your function, like
Functions.
motor power of the hands or the ability to walk properly, this is alarming. What it means that your cervical spine problem, you may have a disc that's compressing the nerve root or compressing the spinal cord, and you need to seek a neurosurgeon urgently. MRI, when MRI done, we see many surprises. When some patient have only numbness in the hand, and we find in the MRI like a huge disc compressing the nerve root. We see these cases, and when this case is diagnosed in the right time and managed properly and with a good management, we get the best results in these cases.
Absolutely, doctor. So from 17% to 30%, it's a very big numbers, and I hope in 2023 it is not going to further increase. So at least this webinar should be really eye-opening for all of us. And at least if even if we are using mobiles, we need to reduce it. And if we are having continuous symptoms that affects our daily routine, daily activities, we should seek a specialist opinion. On that, Dr. Miss Sunita is asking, what are the non-surgical treatments for spondylosis? Probably we need to tell also what is spondylosis, and then we can say.
Okay. Now, when we talk about spondylosis is a very wide spectrum of diseases affecting your spine. This spectrum starts from only muscle spasm, disc degeneration, and ending in instability and disc herniation and spinal canal stenosis. This is the spectrum. Okay. Genetic factors may be included also in having spondylosis, but it have a small percentage. Other factors are modifiable factors, as smoking. Smoking, one of the factors that may accelerate getting disc degeneration and spinal spondylosis.
Doctor, I'll interrupt you here. Doctor, I'll interrupt you here. What is disc degeneration? Because it's a very big word for us to know.
Okay, as Dr. Srinivas mentioned, this disc contains gelatinous material. It's gelatinous material which is contained in cartilaginous or collagenous capsule. This collagen capsule contains this gelatinous material with wear and tear, with weight increase, with massive exercise. This gelatinous material loses its water content. And when it loses its water content, it becomes degenerated. The disc becomes black disc. And this black disc does not function the same as the healthy disc. So it cannot sustain the daily activities or carrying a heavy weight. And then it may lead to disc herniation in the future. This is the problem. And this process may be accelerated by smoking, by weight increase, by bad daily habits like sitting down for long times and in wrong position, like bending forward and carry heavy weight, and people who are not used to do this movement. And we have seen many cases who had just disc herniation when they bent forward and carried like normal subject, because they had the problem already. They had already degenerated discs. They had already disc herniation, but without nerve root compression, and they wanted just this fine movement to get the problem to explode and to reveal itself.
Absolutely. So we were talking about the preventive part of spondylosis, how to quickly deal with it.
Daily exercise. Daily exercise is very important. If you have no time to go to gym, just walking every day is very important in keeping your back muscles strong and preventing spinal spondylosis, like lumbar spondylosis and cervical spondylosis. Daily stretches of your neck, like 6 movements forward and backward and to the right and to the left rotation. Just gentle movements. You do it every day, like 3 times daily. When you set for a long time, and you get strong when you do daily habits. But you are committed to this daily habits. You get better muscles. You get stronger and a more healthy spine.
Absolutely, for all our viewers and our patients, lifestyle modification is the goal at any age, at any point in time, at any age. So that is really something which we cannot escape. We have a question on screen, Dr. Mustafa. Can long-term stress lead to brain tumor?
No statistics that mention that stress can lead to brain tumor, but stress may cause the most common type of headache, which is tension type headache. So stress leads to headache, and tension type headache in chronic types, it's totally devastating, and it affects the life of the patient, affects the function, affects the daily activities. But no statistics that mentions that stress may lead to brain tumor.
Thank you, Dr. Mustafa. Dr. Srinivas, quick question. Neck collars are helpful or harmful? Neck collars, soft or hard, both. You can probably tell us quickly.
I will tell broadly. For non-operated persons, usually the neck collars will do more harm because they will weaken the muscles. They will take away your muscle strength, so that if the muscles become more weaker, and it will cause more problems. So try to avoid collar if it is not recommended by the doctors. Usually, I recommend collars only most of the times for the spinal operated cases where there is some fusion, and we have to keep the neck in the neutral position for some,
Neutral position.
usually for 6 weeks, and not more than that. But in general, avoid collars as much as possible. If you have some neck issues, when you are traveling, when you are driving, there are some expected jerky movements are there, which is putting pressure. That time you can use it because there is no other way. So in
Thank you, doctor. We have another question on screen because we are running out of time. I'll just quickly go through it. How much, Mr. Srikanth is asking a very difficult question for all of us. How much cyber knife or SR is useful in vestibular schwannomas and meningioma cases? So
yeah.
I believe Mr. Srikanth has read a lot, and it's a very good question to ask.
Yes, Srikanth. So, in general, you see, we recommend cyber knife for vestibular schwannomas or meningiomas in a selected manner. First recommendation will be surgery. Surgery will have the best outcomes. But when the tumors are small, like less than 3 centimeters, and we have to preserve the hearing, then we opt for the cyber knife. So, in special situations, the cyber knife is helpful. So this cyber knife for radio surgery, what it will do is it will deliver the entire radiation to a single spot, to that tumor, and it will just heat it, and it will make sure that tumor will not grow. So the cyber knife and all will not remove the tumor or will not evaporate it, but it will control the tumor so that it will not grow again in future. But definitely this may fail. Maybe 50-60% of the times it will be successful. We have to keep on follow up after the cyber knife, because this is not going to remove. Whereas if we go for the surgery, we are sure that we will remove the tumor and we will send it for the testing, like biopsy, so that we will come to know what is the grade of the tumor, how much it can recur, so we can prognosticate. So if we do cyber knife, all these things will not be there. We have to just follow up with the MRI and just be in touch with that.
Doctor, we have this is for both my doctors, whoever would like to answer. Miss Ifra is asking, thank you for valuable information. Thank you, Ifra. I wanted to ask which analgesic or anti-inflammatory medication is safe and effective to prescribe, and for how long before visiting a specialist? So you can give me your opinion, both of you.
Dr. Mustafa, you want to Okay, I will
Doctors,
answer.
patients are really, really smart
No,
nowadays.
no problem. Yeah. If I will tell you, see, these are not recommended. Routine analgesics up to the paracetamol you can take over the counter prescriptions, and any analgesic definitely without the guidance of the practitioner you should not take. But of course, once you have visited already that you have back pain or something, sometimes the doctor has recommended you certain medication that you can take. Usually for a short course, maybe 5 to 7 days you can take. But if it is not going, then you must visit the doctor and make sure that there is no much problem.
Especially if it's very important if it is localized pain, and we know what kind of pain it is, and it is not worsening over the period of time. If it is not troubling you, it is not getting into trouble more. So we are living in a country where we should not delay things and should not self treat also. We don't encourage that. Up to Panadol sometimes it's fine, but still we don't encourage that as well. I mean to say paracetamol.
I want to add something.
Yeah, please, doctor.
Yeah, and in some cases like headache, when you use over-the-counter medications for like overuse of over-the-counter medications, you get medication overuse headache, and this is a very common headache that we see every day. That the patient has taken almost all the medications available, and he still has headache. So the treatment for this patient is to stop taking analgesics, and then he will be fine.
Medicine is never the ultimate goal. Ultimate goal is your wellness, and that should be without medicine. So illness should become wellness, and whether it is going through surgical mode or anything, the ultimate thing is one should be medicine free. So that is how we should think of aiming for our life. Dr. Mustafa, quick question with you. We'll go with very rapid questions now because these have been already asked by our patients before the webinar. How do high heel affect our back? High heels.
Okay.
Does it really affect or no? First of all.
Yes, if you already have disc degeneration, you should avoid using high heel because it will increase the back pain and everything. If you are fit and you practice exercise daily, so you can use it.
Okay, I have a question from Mr. Sajid. I think Dr. Mustafa, you can answer this. For last 1 year, I have observed whenever I get stressed out with my workload or use my voice little louder, I get headache immediately, and that prolongs and moves to my neck and spine. What is the way to go about it?
Yeah, we have to differentiate between having a problem in the neck and spine and having headache because of this loud voice. Loud voice, as I mentioned before, it may cause the tension type headache. It's due to muscle spasm, and it's a very common type of headache. But having a problem in the spine and or in the neck, it has to be evaluated properly.
Thank you, doctor. A quick question, doctor. A second opinion before the surgery. Do you encourage this? Dr. Mustafa. Yes, this question is for all our doctors. So, do we encourage second opinion? Is there really an apprehension, with most of the patients?
Yes, no problem at all. Sometimes we prefer for patients who has doubts and they are not convinced with surgery. When surgery is the best option for them, sometimes we advise them to take a second opinion, because when they do so, they make sure that they need surgery. When they hear someone else telling them the same diagnosis and the same procedure that they need surgery, it will be more convincing to the patient to get the right decision.
Dr. Mustafa, another question for you, since people are coming up with good questions. I would like to ask, Mr. Affan is asking, I would like to ask for brain tumors up to 5 millimeters. In gamma knife advised, or it can be treated through medicines?
Yeah,
yeah, please go ahead.
Okay, it depends on many factors where this tumor is. Sometimes if it's a 5 millimeter tumor somewhere in the brain or convexity, it can, if no symptoms, no treatment is required, and some cases should be followed up. If 5 millimeter in a very delicate area and it's leading to any neurological symptoms, then gamma knife would be the best option.
Best. Thank you, doctor. Dr. Srinivas, role of vitamins in neck pain and back pain.
See, the vitamins we do take, but generally they are not the main things that will cause the neck pain or back pain. Those things we have to concentrate on the diet actually. So if you have a proper healthy diet, then no vitamins are required. At least a 15 minutes walking in the sunlight may be helpful for your vitamin D also. So no need to run for the over the counter and take a lot of medication, and then overeating of all these things can cause the harm. You should be balanced, and whenever doctor recommends, that is fine. Don't take all by yourself.
Dr. Mustafa, your take on the same questions, because this is very, very much talked concern.
Yeah, vitamins by itself, it has nothing to do with when you have spondylosis, and when you have the disc or something. It has nothing to do with your condition, and it has not be taken as overuse of vitamins. We have seen patients who are taking multivitamins for many years, and when we check their B12 levels, we find it high, up to the sky. And vitamin D, patients are obsessed with vitamin D deficiencies, and they take too much vitamin D. And we when we do lab test, we find a very high vitamin D level, and which is harmful as well as harmful as vitamin
And
deficiency.
absolutely, it can lead to kidney failures also to that
Yes,
extent.
exactly.
Absolutely. So we don't encourage that unless your doctor really advises you for that. Dr. Mustafa, quick one for you: osteoporotic fracture, because this is quickly. I want you to talk about it because as we really, moving almost ending the session, but I want you to speak something on that because this is another huge segment. Suddenly, coming fracture and osteoporotic fracture. What do you want to say about?
Yeah, osteoporosis is very common nowadays, especially in postmenopausal females, and in old patients. When they get even mild trauma, they feel back pain. Sometimes some cases neglect this pain, and some in other cases this pain is severe and cannot be neglected. When we do images, we find this osteoporotic fracture and the risk of getting kyphosis in the future. One new technique we do nowadays for osteoporotic fractures is vertebroplasty. Vertebroplasty is a percutaneous procedure by a needle. When a needle can be inserted and artificial bone is injected inside the vertebra, and the patient runs the same day. It's a day case, and the patient runs back the same day, and he can walk, and he can get back to daily activity very soon.
Thank you, Doctor. Dr. Srinivas, I have just very important question for all of us to know. When a patient, any of the person is, getting his spine surgery done, what is the role of his family? How much their involvement is required? Because obviously, we live in communities. We are involved with each other. Does a person who had undergone surgery really requires many people at home, and how does it go?
Yeah. Basically, the spine has got some emotional attachment to it. The pain. If they are in a good environment, there will not be any pain. If you see a patient, if he meets Dr. Raafat or somebody like that, half of the pain will go away.
Absolutely, doctor. Very well said.
So,
I think both of
that's
you, it is really a pleasure
that,
talking always and
yeah.
always to be learned from.
That psychological impact will be there, and support from the family, of course, always it is needed and it is encouraged. But definitely, who are living here alone, the self discipline is more important. After surgery, whatever the precautions have to be followed, if you follow them, then you will have the good result. Whatever the doctor has given to you, you have to maintain it. So always I tell, the 50% is in my hands, 50% is in the patient's hand. If you take care of yourself properly, definitely you will get the best result.
Really want to touch this topic for quick seconds, Dr. Mustafa. By birth, congenital issues. I believe you have a very huge success recently dealt with one of the case, which was also published in all top leading newspapers in UAE. Uh, that area, who should be the people or parents who can approach you and take opinion on that part? congenital anomalies treatment?
Yes, in congenital anomalies treatment, many topics like having hydrocephalus, and we see patients and we see parents. They come to us with ultrasound done, and which is showing their babies having meningocele or hydrocephalus. I know this is a big problem, but we can manage these cases. Sometimes when these patients are early managed, especially cases with hydrocephalus, early management may avoid getting neurological deficit and may protect the healthy brain. And we see kids who grow up and they enter like normal schools having chance, which is not the end for them.
Absolutely, absolutely. So, any kind of such questions, please. Our doctors are always there to reply. We are very approachable, and you can always write to us. You can write to our doctors, and we will be definitely there to answer your questions. If I continue, I think we are not going to stop. A lot of questions coming. Mr. Alate is asking urination too much. I would like to answer because I believe if we take it to neurosurgery part, then definitely you need to seek neurosurgeon's opinion. So for urinating too much, probably it can be infection, or if you are drinking too much water, kidney issues. But the most important thing is to also rule out diabetes. Diabetes also to be ruled out, because if you go into the sector of neurosurgery, then it is really a longer way. You can always reach to us, write back to us. We will guide you appropriately. We have more couple of questions from Mr. Lankar, and I would like to take this question, Dr. Srinivas. Finally, what is the management of keeping our CNS system healthy and fit?
Happy life.
Happy life.
You should, your atmosphere, your environment, your family, your friends, everything. You should have a good cordial relations, and the success will keep coming, and be happy with your life. So there is nothing special management. Our old teachings will always be there. We should pray God and have both physical, mental, social, and spiritual health in balance. That's how you have to balance it. That's it.
Uh, Dr. Mustafa, alarming situations when you have to reach to a neurosurgeon. Just point few of the ones. When it comes to headache and neck pains or upper back pain, what are the conditions where you should not delay the treatment?
Okay, from head to toe, when
No,
you
from
have
I think we will take. You can speak up to the neck, and then Dr. Srinivasan can continue
yes.
the neck spine part.
Okay. When you have persistent headache associated with blurring of vision, a headache that awakens you in the night, and having any other symptoms like weakness in the hand, weakness in the limb, persistent numbness, persistent nerve pain, electric like pain, neck pain is radiating to one side. This is alarming situation when you have to seek neurosurgery.
Absolutely. Dr. Srinivasan, you can continue with the spine. When is it really alarming to see a neurosurgeon?
Yeah,
Not seeing a neurosurgeon.
neurosurgeon or a spine surgeon. First of all, any back pain or neck pain issue comes, you have to observe yourself whether it is really troubling you or not. Definitely, you can judge yourself. If it is really troubling you and if it is alarming, then you have to consult the doctor. So you observe your pain. Don't be panicky. There are certain red flags in the spine issues, like some weakness in the foot or legs or in the hands, or some grip weakness is there. Those are the red flags. Rest of the time, if the pain is the concern, then is it bearable or unbearable, and is it lasting more than certain a week or something, then you have to meet a concerned doctor, whether a general practitioner or an orthopedician or any spine doctor for that matter. So yeah.
Thank you. I think I have learned a lot in this session. So I would like to ask Dr. Mustafa and Dr. Srinivasan quick take-home message, because we have really extended our 1 hour of session. So Dr. Mustafa, take-home message for all the viewers.
Okay, if I will pick one message about neurosurgery at the end of this discussion, neurosurgeons, it's not we are not always focusing on surgery. 90% of our patients are treated in medical and conservative treatment. Only 10% they need surgery, and when it requires surgery, minimal invasive procedures and very short hospital stay and very good outcome will be waiting you.
Thank you, Dr. Srinivas.
Yeah, the take-home message from the Prime Hospital are with our team, with myself and Dr. Mustafa. We are here to take care of you with warm welcome, and we will make sure that you will be satisfied and you will be evaluated thoroughly, and you will get the proper appropriate management. And we make sure that we don't cross and we don't do unnecessary surgeries as and when recommended. Then when we do recommend what is the best suitable option for them, and we do take care of you people, and hope we always continue with the best regards. Thank you.
Thank you so much. With this note, I was Dr. Asia, along with my two specialists, talking about the overall neurosurgery department specialist and the specialties we have under the neuro surgery department and spine, for that matter in particular. Don't make life complicated. Try and keep it simple. Be in the know, because that is what can make your life simple, easy, and you can achieve wellness. I will take a goodbye note from here, but I would like to tell you that we will be coming soon on 8th of March on International Women Day. Join us for that session. A lot of topics related and around to women health, and anybody can join. Thank you. This was Dr. Asia with you live from our official Facebook and LinkedIn pages. Thank you so much.
Thank you.